Good afternoon, everybody. This is County Executive Ed Day. Interrupting our Facebook Day for a few minutes to bring you an update on where we are with the incidence of polio that has come onto this county. There has been a number of things that we've been doing and a number of advancements that I think everybody should know about. So we want to touch base so everybody understands what we are encountering, what we're looking to do, and the most important thing is let you know what we know, let you know what we don't know, and also let you know what we're doing to address the issue that's in front of us. Just to get on the same page, this goes back to an individual who was hospitalized back in mid-June. I believe it was in the city, if I remember correctly. We were notified on July 19th that after some testing or some investigation, medical investigation, they determined that this particular person had a case of polio. There were lab specimens sent out, and they were able to confirm that. They confirmed that on July 19th. We were notified directly, and again, I give credit to our health department. Well, when we got notified, they immediately they didn't just make a plan. They immediately put a plan in place with implementation dates, which were immediately following. We publicly announced this once we were squared away on July 21st, so everybody understood what occurred and what happened, and we did that up at the Pomona Health Complex. Important to recognize one thing, that we've had one case of polio here, and that one individual was no longer contagious then, and is no longer contagious now. That individual did suffer some paralysis, so it did impact him. We're going to go into some of the things that we've been doing because polio is a very unique disease that can almost defy things such as contact tracing for specifics. In general, we can do some things that we're going to get into in a few minutes. Not long ago, there was testing done in England, and they found there was some polio virus in the water, in the wastewaters. Our health department did look at that and requested that we do the same here in Rockland. So we did testing at the Rockland County Sewer District number 1, which covers Ramapo, Clarkstown, and a very small piece of Orangetown. This is before we were notified about the polio case here in Rockland County. Those strains of vaccine, the vaccine-derived strain, one thing I do want to say, the individual who was infected with polio did not get that virus from anybody here in Rockland County, to the extent that the strain that was identified that infected him was a strain that was used in the oral immunizations some years back, which was the sugar cube. Some of you may have had that. That was used widely in the States at one time. It's still used to this day, primarily, obviously, outside this country. The problem with that, in rare cases, the strain that's used, it's a live virus, will mutate and could turn around and infect someone and make that person who has the vaccination contagious. They were able, the CDC and the State Department of Health were able to identify that strain as coming from someone who received that polio virus, the oral administration. And that's how this all started. So I want people to know where this came from. It will hopefully eliminate some undue concern that some may have. But we do have to have some concern about this for a number of reasons, which I'm going to get into. As a result of the request to do these wastewater sampling, we did find detections in the Rockland County Sewer District number 1. Again, as I said, that encompasses Clarkstown, Ramapo primarily, and a slice of Orangetown. Further tests are now being done to narrow down those origins of these strains to the towns and villages. We have now also the entire county is now being tested with an eye on the origin. We cannot often tell who may have this, because the reality is that 74% of the people who contract polio have no symptoms whatsoever, none. 25% have mild symptoms, and they're very similar to the flu. 1% of the people who contract polio actually get the disease that we know had crippled children, that had paralyzed people, etc. So that may sound like good news, but as we go through this, I think you're going to see the impact of trying to track down a disease that most people, 99%, have no symptoms whatsoever. And this is where we're going to be using the testing. We did check with the CDC, and again, we welcome the CDC's presence here. I said this on Channel 4 last night. CDC was contacted early on by a health department. It's a natural course of events. They were there to help us through the measles crisis, and we're working with the State Department of Health, and we're also working with the New York City Department of Health due to the movements of the particular individual that we referenced early in this program. So once we get the origins squared away, what that tells us, and what that gives us, is an opportunity to go to areas that we need to get vaccinations up. That is the critical piece here, because at the end of the day, if you are vaccinated from polio, you are completely safe. There is no issues. A 99.9% success rate. And on top of that, this vaccine is 65 years old. I was one of the early recipients of this in the 50s. I remember those days quite well. We were all lined up to go into the basement of the church and get our shots. But again, 75% of people being asymptomatic can translate into a single case of polio. A single case of polio could be the tip of the iceberg. We don't know, and that's the part I want to share with everybody. There are things that we do not know. Every one case of paralytic polio observed, which is a symptom our resident did exhibit, there may be 100 other people infected. Remember, I gave you that 1% number. So that 1% is one person out of 100. And we could have other people infected. As you can see, that could turn into a bit of a wildfire. And with the caveat that I'm going to share with you, that only happens if people are not vaccinated. This is not something that we cannot fight back with. It's not something that we have the ability to stop. We have the tools in our toolbox to stop this disease cold. But without that tool, or without that tool being utilized, we could have a wildfire here. And when you hear the State Health Commissioner talk about the tip of the iceberg, this is what we're speaking of. Polio is only preventable with the vaccine. There's no getting around it. There is no cure for polio. The only cure we have is the vaccine. And, again, it's something that I said before. The vaccine is 65 years old. It's tried and tested. Some people out there who ascribe to the anti-vax origin of things have a tough time arguing that this is not a viable vaccine. To give you a sense of the polio vaccine, it nearly eradicated this virus. At one time, there was 400,000 cases worldwide. Now there's only 800. In the 80s. Now there are only 42 cases worldwide, and that was in 2016. So that's how powerful this vaccine works. Like I said, many of you may be too young to remember what polio could do. I remember polio very clearly as a 4, 5, 6-year-old kid. And the reason I remember it is there was a complete fear in the street I lived in Brooklyn, because we had friends of ours who did contract polio. One of my schoolmates contracted polio. I remember my mom and dad having quiet conversations, and the word polio came up. I would look at my dad's face change. And my dad was a World War II combat veteran. He didn't get upset about anything. But this is the one thing that scared everybody. Right now, I think we should maybe put a picture to the faces that we're talking about. This is what, Beth, is this okay? All right, this is some of the hospitalizations we saw in young children who contracted the polio, full blast of polio. There's a young girl who's in a wheelchair, and where she can get around with metal braces around her legs. And as we should know by now, polio is a worldwide issue. This is not a Rockland County issue. It's a worldwide issue. And we have now found that, again, a foreign visitor is the source and the origin of this particular individual sickness. And this is some children in another country, actually. But this is what this will do. And there's a reason why I'm focusing on our young people. If you're an adult, you should be vaccinated. There's no getting around it. According to the CDC, 92% of the people in the U.S. are vaccinated against polio. 92%. Some people have asked, what is Rockland County's percentage of vaccinations? We don't know. And again, this is something that we don't know. And if people would stop and think for a second, think about this. Young children from 2 months of age on as they go to school, there's no legal mandate for them to get this vaccination or the other vaccinations that are traditionally given to young people. It's advised by pediatricians. Most families do take them up on that, but there's no order or no forcible compulsion to do that. That point is when the children go to school. So our vaccination rate right now just went from 59 to 61% for those who are 2 years old and under. It jumps 20 points once these children go into school. And there's a reason for that. Some people have made comments about the schools not doing their job. I've had meetings with BOCES, who oversees all the school districts in Rockland County. They already, again, have reminded the district superintendents that there will be no quarter given if these regulations and these laws of New York State are not followed. This comes on the heels of the measles epidemic back in 2018 and 19. When that was all said and done, I sat down with the school leaders and I did explain to them, look, we cannot afford to have failure here. Children who must be vaccinated, they cannot go to school unless they are vaccinated, and the documentation must be present in the schools. And we basically said, while the state of New York is responsible to ensure this law is followed, it's not up to the villages or the towns or the county. The state of New York, they're the ones who are supposed to make sure that these children get vaccinated. We committed here in Rockland, members of our health department, to physically visit these schools to make sure, just to make sure that these vaccinations are being given. And we did see an increase in compliance. That compliance now has shown itself again because the numbers are now much, much better. I know I have I got that, okay. We had over 11,000 infants under the age of 2 in Rockland County are at risk right now because they are not fully immunized. 11,000. One of the things that our county health department did do, before any of this we were even notified about this situation, they sent over 3,000 letters out to families they identified who had infants and who had not started their schedule of immunizations. So this is something our county health department was already ahead of in doing. But there are many children out there who are now at risk. According to the New York State Department of Health, and we do have the list of the schools here. I'm not going to read them all to you, but at least 98% of our students are vaccinated against polio. So schools are doing their job by and large. And again, is it perfect? Absolutely not. We've identified a couple of schools. One school in particular, I think they're at 80%, 79.7%. We will be making sure that school gets those numbers back up again. But it's a much smaller group of schools. This includes private and public schools that we have to address, as opposed to the last time with the measles epidemic, where that checkpoint kind of disappeared in many cases. So that's something we are going to be staying with and staying on. The actual breakdowns for schools, 96% of the schools are 90% immunized. 3% of the schools are 80 to 90% immunized. Less than 1% of the schools at 79% immunized. I believe that was one school. So we are addressing that. The schools are out, so we've had the time to get out there and speak to them. I want to compliment BOCES and Amy Albers, the Chief Operating Officer, for taking our information and moving forward with it to all the schools. She wrote a very direct communication to all the schools to make sure that we are ahead of that and stay ahead of it. We're continuing to offer immunizations Monday and Wednesday by appointment at a health clinic, but I will remind everybody, you can get vaccinated from polio from your local health provider. And while I'm at it, one of the questions I got from a lot of people, how do I know if I'm okay? How do I know I'm immune with polio? I don't remember if I got the shot. Nobody in my family is really, the older folks are past. They're not here anymore. How do I know? What should I do? What you should do is don't look at anybody on Facebook. I'm only kidding around. What you should be doing is contacting your health provider, your primary care physician. Let he or she guide you and assist you in traveling through an issue that's a medically based issue. That's who you should be speaking to. If you don't have a provider, contact the health department. It's as easy as that. We'll be happy to guide or assist you in any way we can. We're continuing to plan vaccine clinics, including a community clinic next week. More details are on our website. As of now, we have 1,500 or so people.
Vaccinated?
Yeah.
Over 1,400.
Over 1,400 people. By the way, I must correct my manners. I have with me John Lyon, who is my chief of staff. You may remember John is the man behind the curtain. When we did the COVID things, he hates when I do that to him. And also our new communications director, Beth Cephalo. I want to welcome them on board and thank them for their help. Our health department is talking daily with the state health officials and with the CDC. It's the communication that we had with the measles crisis, and it continues right now. The CDC, we had requested some assistance from them. There was a back and forth for a little while, but there is a small team here in Rockland. It got here last week, and it's assisting us in every way possible. What we look for the CDC to do is cut through any lines of potential obstructions to communication. If we have to speak to the federal government, for example, they will help us with that issue because they're a federal agency. We look to help them for identification strategies, which is exactly what we're doing with the wastewater, and also for immunizations, help us get many people immunized as possible. And again, our health department is having ongoing conversations with our local providers and community leaders. Good Samaritan Hospital, Refuah, who really did an amazing job during the measles crisis and getting shots into arms. We have community providers and also the pediatricians. We communicate with everybody who has reach and insight into getting to families. We look at the variety of things that are out there that prevent people from getting their children immunized. There are some folks here in this county who are not documented. Again, like everything else, public health is an exception. That is not something you should have a concern with, and we're reaching to the leaders in these communities to let them know. We have many communities here in Rockland County that are a bit closed. We will always try to get across to them. We are speaking to many of the rabbis here in Rockland County to help us break down any kind of. We had what they called outliers, John. Remember, we had the Jewish faith leaders of all accounts talking about how important it was to get measles vaccines, and we still had some outliers and some sects that just weren't getting it. So we're doubling down on that. We also have new posters that are going to be distributed, or in the process of being distributed, to grocery stores, doctors' offices, summer camps, houses of worship, and county property. This is what they look like. Can you see it? Okay. And this will be going out. This will be going out in numerous languages. Again, this is being distributed as we speak right now, and others in different languages will be also sent out. Okay, I mean, right now, that's pretty much, I think, John, did I miss anything offhand? Beth?
I think you covered everything. But just to reiterate, we're spreading this message to anyone and everyone around Rockland. Mm-hmm. These posters will be distributed everywhere we can put them. The more awareness there is that people who are unimmunized, that they need to get immunized, that's the best resource we have for you to, avoid something that is avoidable. There's a vaccine that completely prevents this, and we don't want to see any additional people present with cases, particularly cases that involve paralysis. There's no cure. There's no fix for that. Right. The only fix is preventing it entirely. Correctly. Thankfully, we can do that.
Yep. And again, we can track so much here. We have a very good handle on the children who are of school age. We know who has been vaccinated. If there's a shortfall, we can find that and fix it. We know there's many. There are adults out there who may or may not be vaccinated. All I can tell the adults is get vaccinated. But we have a component of children, babies, 2-month-old babies, and 2 years old, that are low. They're not vaccinated, and they're at risk. And going back to the beginning of this broadcast, I spoke about only 1% of the people actually contract a serious case of polio. And that sounds like a good thing, except for the one problem is that 74% of the people have no symptoms, 25% have a few symptoms that are flu-like. So 99% of people who actually have polio in their system, have it in their system, and can spread it, don't know it. They have no idea. And what I would say to folks who are not vaccinated, who are adults, who frankly between us should know better. You can stop this disease cold from ever gaining root in Rockland County. That has not happened yet. As of right now, we're tracking down wastewater samples. We know the disease is here. We still have a fight on our hands. We still can stop this dead in its tracks. And that's the only way we can do it is with vaccinations. What I would say to an adult right now who is not vaccinated, doesn't really quite get it, or really think it's not a big deal, I don't think you want this on your hands. Because that's exactly what we're talking about right now. We're talking about a young child who cannot protect him or herself. And the only people who can protect that child is a dad, a mom, an uncle, brother, people in the household. And some of those people possibly could have polio in their system and not show any kind of symptoms. So I'm asking you, as a leader of this county, please put others first, put your loved ones first, all right, and please get vaccinated. And to those who have families with young ones, speak to your pediatricians, speak to your community leaders. Understand that we're here trying to make sure that that type of disease does not befall your child, does not cause your child to have a life that will be changed forever, and that child may not even live. So we make sure these things happen. So I don't want to get too over dramatic here, but my drama comes from a friend of mine in school back in the days in the 50s who contracted polio, and it was not something I'd ever want to see happen to anybody else. So with that, do we have any questions?
Just one thing I'll stress. There's someone asking, they received the vaccine as a child, asking if they are still protected. If you receive the full vaccine series, you are, but if you have concerns, talk to your primary care physician,
Yep.
talk to your doctor, talk to them about your concerns, and they'll address them.
And in fact, the issue was publicly, again, I urge people to see their own doctor for a reason. I don't want, Google is wonderful, Facebook is great, but I don't want you taking your final bite of the medical apple from social media, all right? There was a periodical that was put out by someone, I think, who was on news in the city, and he recommended boosters. Now, that created a whole bunch of conversation on Facebook, but then we looked at the issue of boosters, and the CDC recommends boosters only under certain circumstances. So before you rush out and get a booster because Dr. So-and-so, a talking head on channel whatever in the city, said you should do it, as John said, see a doctor, let them look at what your situation is. I think there are testing they could do, if need be, to see if it's, I guess, if it's still the titers we use to project your immunity against measles. I don't know if it's the same, if it's the same with polio. I'm not a doctor. I don't know the answer. None of us here are doctors. So speak to your doctor and get an answer that's clear, that fits your particular situation. Anything else? Okay, well, that is pretty much where we are right now. Again, we are doing everything in our power to stay ahead of this. We need partners, and the partners are you. We need you to help us out to get the word out that this is serious. It could get worse, or we could stop it dead in its tracks. I know we have the ability to do this here in Rockland County. We did it once with measles. We can do it again now. But again, this has to be a team effort. Every Rocklander has to be on board with making sure that they take care of themselves, that the children are on immunization schedules from 2 months on. Friends and neighbors, families, aunts, uncles, brothers, sisters, let's all work together here. And we will make sure that we keep polio in the wastewater and not anywhere else. All right. With that, signing off. Have a wonderful evening.